Hello and welcome to Speaking of Health, a place where you can learn how to live a longer and healthier life. I'm your host, Jason Howland, and joining us this week from Fairmont Medical Center, part of Mayo Health System, is board-certified ophthalmologist Dr. Daniel Peterson. Thanks for joining us today on Speaking of Health.
Thanks for having me, Jason.
Well, today we're talking about the leading cause of vision loss and blindness for older Americans, macular degeneration. First off, what is it?
That's a great question. Macular degeneration is a condition that affects the back part of the eye. There's a tissue in the back of the eye called the retina, which functions much like the film in a camera does. It takes light and turns it into a picture. The macula is the center of the retina that we use for our fine, detailed vision. Macular degeneration is a condition that affects us as we grow older. A significant number of Americans over the age of 60 suffer from it. It is the leading cause of severe visual loss in Americans over the age of 60. It's estimated that currently about 1.75 million Americans have some form of macular degeneration, and that number is expected to grow as our population ages.
And so we're looking at millions of people that could have macular degeneration here in the future, right?
Exactly right.
So you talk about the detailed, sharp vision is what the macula is responsible for. So is that, in particular, is that for reading and some of the really is that what you mean by detailed vision?
That's exactly right. Reading, driving, watching television, other fine detailed work like threading a needle or reading music for musicians, anything like that requires the vision of your macula.
Well, are there two different types of this disease?
Yes, there are two broad categories of macular degeneration, and they are known as the dry and the wet form.
And what's the difference between the two?
The dry form, which is the more common form, is a form in which tissue in the back of the eye, the retina and the underlying structures simply are lost. That is present in approximately 85% of people who have macular degeneration. That tends to be a slower, more gradual onset of visual loss, although it can be more rapid and severe in rare cases. Wet macular degeneration refers to some abnormal blood vessels which grow underneath the retina where they're not supposed to be. Those blood vessels are leaky. They leak blood and some other components of blood, and then the retina absorbs that fluid like a sponge absorbs water. Much as a sponge swells when it absorbs water, so the retina swells, and that causes the vision to decrease, often in a severe and rapid manner.
So are the symptoms of the two, dry and wet macular degeneration, are they the same?
Oftentimes they are. It is possible to have macular degeneration without symptoms in the early forms of the disease. If you have macular degeneration in only one eye, which is possible, you can sometimes compensate with your other eye, and so you don't notice that you've had visual loss in the affected eye. The symptoms typically will range from very mild distortions or problems with the central vision, problems reading fine print, etc., to, in its most advanced form, you may have a very large blind spot where you can't see at all in the center of your vision.
Is there pain involved at all in the symptoms?
Unfortunately not. Pain would actually be a useful thing so that folks would be aware of what was going on, but because the back of the eye doesn't have those pain fibers, there is no pain associated with it.
So you talked about it happening in just one eye. Is that often the case, or is it generally in both eyes?
Most commonly it is in both eyes. Oftentimes folks will begin with it in one eye and then it will show up in the other.
But like you said, your good eye, if you have it in just one, your good eye will compensate and you don't see the symptoms until they've progressed even more?
Exactly right. Our brain is set up to take input from both eyes to make our picture, if you will, that we see, and so our good eye can compensate for the bad eye to a degree. People who have macular degeneration need to be instructed on how to test their vision in one eye at a time to make sure that things aren't changing.
So what causes macular degeneration?
We think the most common reason is simply aging, age-related changes in the eye, but we do know that there are some risk factors, some of which are controllable, some of which aren't. Smoking is the most important controllable risk factor for macular degeneration, so it's very important, in someone who has a family history of macular degeneration, or their physician has diagnosed them as having macular degeneration, to stop smoking.
And why is that? Why is smoking such a risk factor?
That's a great question. We don't know the exact answer to it. It's thought that smoking causes release of some inflammation markers in the blood, and there's some evidence to suggest that macular degeneration may be related to inflammation.
So it may have to do with the secondhand smoke, or actually having smoke in your system, or the nicotine or whatever?
Either smoking yourself or secondhand smoke is potentially a risk factor.
Okay. Well, what are some of the other risk factors?
A family history or a genetic component, it has been identified in many people who have macular degeneration. So if folks in your family have it, you are at an increased risk of getting it. Light skin, Caucasians are at a higher risk of getting macular degeneration. People who have a history of extensive sun exposure may have a slightly higher risk of macular degeneration. People who've had cataract surgery have a slightly higher risk of getting macular degeneration. There have been some dietary changes which have been identified which may be protective in people. Eating omega-3 fatty acids, which are often found in fish, eating olive oil. Those may be protective for people to prevent the development of macular degeneration.
Do you see it more in men or women, or does sex not matter?
It's slightly more prominent in women, and it's slightly more prominent in people who are farsighted, and we don't understand the reason for that.
So how do you test for AMD?
Unfortunately, there's no easy test for the patient to do at home. What they need to do is, beginning around age 50, it's a good idea for everyone to come in for a dilated eye examination so that the ophthalmologist can look into the back of the eye and visualize the macula. That is really the gold standard, if you will. The best way to test for it is to look at the macula.
So even if the patient doesn't have symptoms, you as an ophthalmologist can go in, look at the back of the eye, and actually see that macular degeneration happening?
Absolutely. We oftentimes will pick up the early stages of it in people who didn't know that they had it.
And so what are some of the other tests besides the eye exam?
Once the exam has shown evidence of macular degeneration, other tests can be performed. There's a test called a fluorescein angiogram, which is used to evaluate for the wet kind of macular degeneration, where a dye is injected into the patient's vein and photographs are taken in the back of the eye. There's a test called OCT, which measures the thickness to look for swelling of the retina. Those are the two main tests we use to evaluate further macular degeneration.
All right, so now a patient's been diagnosed. They've come to see you. They've been diagnosed with macular degeneration. What are their options?
Well, the main difference in terms of treatment would be whether they have the wet or the dry macular degeneration. The most important thing, first of all, would be to make sure that the patient, if they smoke, stops smoking. If they have dry macular degeneration, we have shown in a large study that taking a vitamin combination with vitamin A, vitamin C, vitamin E, copper, and zinc may decrease the risk of getting worse. Unfortunately, at this point, that's the best we have as far as treatment for the dry macular degeneration. But the wet macular degeneration, which previously was not treatable very effectively, we now have some injections we can offer, some shots into the eye, which oftentimes can make those abnormal blood vessels shrink up and sometimes go away.
And does that help relieve some of the symptoms then?
Yes. Over 30% of people who get those shots have a significant improvement in their vision. So it is by far the best we've ever had to offer people who have wet macular degeneration.
So it doesn't cure the condition, but it definitely makes their vision better though, right?
It often can make the vision better.
Mm-hmm.
The shots are done in the office. The eye is numb and comfortable. The shots are done about once a month, and most people require multiple shots. Sometimes we can get those blood vessels to go away entirely, but oftentimes we need to continue to give them indefinitely.
And this is something that has come about here in, the last 5 years or so?
Yes, within the last 4 or 5 years, we've had different shots available, and currently there are a couple that are used most commonly. So
is there a way to prevent macular degeneration from happening to you as we age? Is this something that's just inevitable? It's going to happen, or are there things that you can do in your life to prevent it?
Good question. Most important thing that we can control, again, is not to smoke. Okay, or if you do smoke, stop smoking. Your family history, unfortunately, you can't do anything about. Again, taking omega-3 fatty acids, fish oil, if you will, eating with olive oil has recently been shown to potentially be protective. Wearing sunglasses when you're outside is a reasonable thing to do. Those are the main controllable things we know at this point that may be beneficial.
And we talked about this being a disease that affects folks that are a little further along in life. Do you see it at all in patients that are under the age of, say, 50, 60 years old?
We do. There are actually what we call some juvenile forms, or in children even, that are thought to be forms of macular degeneration. But by far the most common patient who gets it is over the age of 50.
So wrapping up, if someone is having vision problems, when should they think maybe this could be macular degeneration?
Anytime you have a significant change in your vision, it's a good idea to be examined. Mm-hmm. What specific things could be indicative of macular degeneration? It would be a change in your central vision. Okay, so when you're looking at a piece of paper or tiles on the floor, if you notice a blank spot or a distorted spot, if your vision rapidly declines, any of those things could be a warning sign of macular degeneration. And again, we would encourage you to be seen as soon as possible to get that evaluated.
Now, is it a blind spot where it is a black spot in the center of their vision, or is it just blurry, or how does it look? It
can be anywhere in that spectrum. It can just start with some mild blurriness or distortion, but in its most severe form, macular degeneration will in fact give you a black or a blind spot in your central vision.
All right, very good. Well, unfortunately, we're all out of time, but we want to thank Dr. Daniel Peterson, board-certified ophthalmologist at Fairmont Medical Center, for joining us today on Speaking of Health, a great topic. Thanks for joining us.
It was my pleasure.
And that's all for us. Have a great day, everyone, and be healthy.